Good afternoon. I'm Seema Kumar, CEO of Cure. Cure is an innovation campus in the heart of New York City with an ambitious mission, advancing healthcare and finding cures. On behalf of Cure and the C3 Summit, it's my honor to introduce General Petraeus and Ransel Potter, who is a founding and managing partner of the C3 Davos for Healthcare Summit. General Petraeus served in the U.S. Army for 37 years, where he learned a lot about the impact of war, including on healthcare. In conflict zones, even food and shelter may be a challenge. Lives are lost, not just due to the ravages of war, but due to a lack of access to basic healthcare and essential medicines. General Petraeus, thank you so much for your service to our country and for your insights on global health. Ransel, take it away.
Thank you, Seema, and thank you, Cure, for hosting this meaningful conversation with General Petraeus for the C3 conference. We all know that conflict and war are generally destructive and harmful to all impacted. Some would even argue that there can be certain unintended positive outcomes, but positive or adverse either are often complex and context-specific. For this reason, it's important to approach both that can arise from conflict with a nuanced understanding. With that, I'd like to begin, General Petraeus, for thanking you for coming. It's a pleasure to see you again. And I'd like to really start with the adverse of conflict and the impact on infrastructure and services. So my first question would be to you, since you were on the stage with us in New York City last year, how have geopolitics and conflict evolved since then?
Well, first of all, Ransel, great to see you. Great to be with you all again. I wish it was in person instead of by Zoom, in my case, from Paris. But it still does enable us to engage on some pretty serious topics, and that's a pretty good starting question. The fact is that over the last year, we have seen a continuation of a trend that has been ongoing for at least a decade. And that is a transition from a world of benign globalization, in which barriers to investment, capital flows, data, trade, and so forth were all being reduced. Globalization was on the march, trade was going up, to a world of renewed great power rivalries, new conflicts, literally all around the world, and really seismic change from an era in which economics largely drove geopolitics to an era in which geopolitics is back with a vengeance and is very, very much influencing economics, trade, investment, and so forth. All of those barriers that were going down a decade or more ago, in fact, when I joined KKR and established the KKR Global Institute, have been going up. And they've been going up on a near weekly basis. We see considerable new protectionism, industrial policy, friction between countries, the relationship, the most important relationship in the world, which is that between China and the US and our Western partners and allies, is described as one of severe competition. And of course, what we need to do is ensure by the actions in the relationship, including most recently a visit by our national security advisor to China for the first time since I think 2016 or so, to establish a floor in that relationship, get guardrails, have understandings, and ensure again that what is understandable competition in many realms, again, does not ever erupt into outright conflict.
That brings me to, because you've alluded to, which we all know, the devastation and how conflict has affected the physical infrastructure of healthcare facilities. So my question are, what do you think are the main challenges in maintaining or restoring these healthcare services during and after conflict?
Well, there are numerous challenges. As always, there's never any single factor in any one of these kinds of situations. And as a former economics professor, I'd also then have to add that it depends. The answer to every question should always begin with it depends, and then you list the various factors that are there. But you see in some cases, I mean, let's just start with Ukraine, and I'll be there next weekend. In fact, it'll be my fourth trip there in about 15 or 16 months. And I've watched actually as the Russians have hammered the electrical generation infrastructure and transmission infrastructure. That obviously puts great limits on what medical facilities can do if you don't have reliable heat and light and so forth. But beyond that, they have directly targeted those facilities. They hit directly the Children's Hospital, the major children's hospital in Kyiv. They've done the same in other locations. They've also, in some cases, it appears, deliberately followed up strikes with further strikes to actually go after the first responders, who of course include not just police and fire department personnel, but also a variety of different medical and emergency ambulance facilities as well.
One of the questions I have is that we now know, for instance, that in Gaza, we've had the first cases of polio that have reemerged. And that in itself is a little bit frightening to think that there are something like 187,000 children under 10 that have been vaccinated now with a new polio vaccination. How do you think that has then helped raise the bar in terms of what real awareness and what real types of needs that we can bring to those that are really looking for the kind of help and healthcare that we can provide as a country?
Well, I think it was almost to be expected that if you don't have security and if you don't have authority in an area, it's really hard to deliver healthcare. In this case, it was the polio vaccines. Again, polio was basically eradicated from the world. And there it is back, which, as you note, is very scary, but it's a direct result of different international organizations, actually the local organizations on the ground there, not being able to, in an orderly manner, vaccinate children. And there are numerous other medical activities that are not possible as well. In fact, I've been an advocate for a vision for what will security in Gaza look like, obviously without Hamas and without Hamas being destroyed and Hamas not governing. But I have encouraged those with whom I talk in the Israeli government to push for a vision for what Gaza will look like, who will administer it, how you will maintain security. Keep in mind, there's a famous quote from the Vietnam War by John Paul Vann, who was one of the iconic figures, first in uniform as a lieutenant colonel and advisor on the ground. Later, he came back as a civilian and stayed many, many years. And he said one time that security may be 10% of the problem, or it may be 90% of the problem. Regardless, it's the first 10% or the first 90%. You have to have security. And right now, there is not a plan laid out, at least. There is certainly a lot of activity to degrade Hamas very considerably, to ensure that tunnels from the south can't be used again to rearm and re-equip Hamas, all of which I agree with strongly and support Israel in doing that.
I'd like to ask you, and you've alluded to this a bit, about strengthening alliances. How does conflict solidify and impact alliances and really foster cooperation between nations with shared interests, such as NATO's formation during the Cold War?
Well, I think a common threat is a pretty good catalyst for the establishment and maintenance and sometimes revival, really, of alliances. If you look at what has happened really since Vladimir Putin took over in Russia, certainly over the last decade or so, the greatest gift to NATO has been Vladimir Putin. I say that somewhat tongue-in-cheek, but if you look at where NATO was in the absence of the kind of threat that the Soviet Union posed, and which, of course, was the reason for the establishment of and expansion of NATO over the years. And obviously, after the Cold War, the NATO's reason for living seemed a bit diminished. Yes, it got involved in so-called out-of-area missions and so forth, including that in Afghanistan, where I was both a NATO 4-star and a US 4-star. But of course, the threat posed by Russia, by Vladimir Putin, was very stark. The initial invasion of Ukraine in 2014, the occupation of Crimea, and the support for the separatists in southeast and in the Donbass region of Ukraine, and then, of course, the much more substantial all-out invasion of 2.5 years ago, when Vladimir Putin sought to deny Ukraine's very right to exist as an independent country. That has obviously spurred enormous unity among NATO. They're not without some cracks, but by and large, tremendous unity. It has fostered dramatic increase in the number of countries that are spending the 2% of GDP on defense that was agreed at the Wales summit a decade or so ago. There's a great more seriousness of purpose. There's a whole new command structure, operational concept, strategy, and so forth. And again, nothing concentrates the mind and forces that kind of activity like the threat that is posed by someone like Vladimir Putin and the country that he leads, which has so much in the way of manpower, again, oil, natural gas, minerals, and so forth, and an economy that is 10 or 15 times the size of that of Ukraine as well. So, what is it that causes alliances to come together? It's a common threat, common values, common interests. And when you find that, you will see the banding together. We see some of this, I think, in the Indo-Pacific region as well. You see greater concern by countries on the periphery of China, especially those that share a maritime border with China, most of which are in dispute of some type, and where China is being more aggressive in pursuit of its claims, many of which have been rejected in international courts. So you see the Philippines welcoming the United States back. You see much greater defense spending, doubling the defense budget of Japan over a 5-year period or so. You see cooperation between Vietnam and the Philippines. All of this takes place, again, because there is a common concern, a common threat, and a desire for security and cooperation that can help to balance against that particular threat and provide solid foundation for deterrence. Noting, of course, that deterrence is based on two elements. It's the potential adversary's assessment of your capabilities on the one hand, and we always have to keep improving those and hardening them, dispersing them, modernizing them, defending them better, et cetera, et cetera. And it's the potential adversary's assessment of your willingness to employ those capabilities, and there has to be assessment to ensure that that is never called into question. And here I just note that in the book Conflict, of course, which I co-authored with Andrew Roberts, and we talked about last year on stage, we note that what takes place in one part of the world can often influence perceptions in another. And I would submit that if the world failed to do all that it possibly can to support Ukraine in its hour or years of need, that would call into question whether we'd be willing to support other countries elsewhere in the world where they seriously threatened.
Well, General Petraeus, that is a wonderful note to end on. I'd like to thank you honestly for your time in addressing the impacts of conflict on bilateral healthcare, but more importantly, the impacts of conflict on all of us. The one thing I've learned with C3 and being around great leaders like you is that it's all about a dialogue. If we can begin to create a dialogue, we can begin to have some opportunity to create change and help one another. And you've certainly done that over a very incredible career, and I thank you for your service as well. And before I let you go, is there anything else you'd like to say other than what you've already added to this wonderful conversation?
Well, really, just first of all, the privilege was my service was a privilege of a lifetime. Second, it's always great to be with you. Next year, I hope it's back in person again, as it was just not possible to be this year. But then also how important what it is that you are discussing, doing, supporting the initiatives of CURE and so forth, and what all of those in the audience are sharing with each other. That's how advances come about, and that's why I've been engaged with C3 Summit every single year now for a number of years. So again, thanks for the invitation to return, and I hope to do it again next year, but in New York City.
Well, we hope so as well. It's a standing invitation, and I've already got you down, General Petraeus. So safe travels. Thank you for everything.
Send the date now. We fill up a year in advance.
September 8th, I can tell you right now. That's it. Okay. Well, thank you again, Cure. Thank you again, General Petraeus. Addressing the impacts of conflict on bilateral healthcare requires coordinated efforts from governments, international organizations, NGOs, and healthcare providers to ensure access to cross-border investments, essential healthcare services, personnel support, and best practices to mitigate public health risk in conflict-impacted areas. Exploring these questions like we did today can provide a comprehensive understanding of how conflict impacts healthcare diplomacy by highlighting both the challenges and the unintended consequences that may in fact prove positive. This balanced perspective can help inform and define future strategies for supporting conflicted regions that are dependent on our bilateral healthcare relations. And this today was a perfect example of that. So again, my thanks to Cure, my thanks to General Petraeus, and all of you in the audience who have continued to support C3 over the last 13 years. And now we're headed into year 14, and a commitment from General Petraeus to come back and join us again in person. Thank you all so much. Have a great day.